Hello everybody, I am Dr. Padmakali Kar, a consultant neuropsychiatrist based in Kolkata, and today I will be speaking a few words about the mental health problems among the working women. Now, mental health is a major public health concern worldwide. It is a major contributor to the global burden of disease, and people with optimum mental health have the ability to respond to diverse experiences of life with flexibility and also a sense of purpose. It can be described as a state of balance between an individual and his surrounding, or as a state of harmony between oneself and others. So we see the foundation for the well-being of the individual and the community is good mental health, and the good mental health of a woman is important for their own health as well as the well-being of their children and families. Women are more likely than men to be adversely affected by mental health problems, especially anxiety and depression. Status of women in the society has been changing fast due to multiple factors such as urbanization, industrialization, increased level of education, awareness of one's rights, and of course the media influence. More and more women nowadays prefer to be engaged in some employment so that they can contribute financially to their family. But the attitude towards women, especially married women, and their role in the family has remained more or less unchanged. And the taking care of the family members and children are still considered to be their primary responsibility, and thus carrying out the responsibilities and duties at home and also at the workplace overstrains a married woman, and thereby it can lead to different psychological problems like role conflict, job strain, mental fatigue, stress, anxiety, frustration, depression, anger, phobias, and other social and emotional distress. All these problems can interact and affect the mental well-being of a woman. Studies have shown that working women have poor mental health compared to the non-working women. Though data regarding this is sparse in our country, but a study which was carried out in Orissa in 2014 showed that nearly 33% of the working women had poor mental health outcome, and only about 9.5 or 10% of them sought any kind of mental health services in the public or private health sector during the course of a decade. Poor health-seeking behavior might be attributed to the social stigma attached to mental disorders, or it might be due to the lack of awareness about mental health or the availability of such services. Another study revealed that younger married women had poor mental health as compared to their older counterparts. This could be due to the reason that younger women might be overburdened with the new additional responsibilities after marriage. Women whose husbands were alcoholics or addicted to drugs, or whose family members suffered from any kind of chronic mental illness or physical illness were found to be at an increased risk of developing poor mental health. Home and workplace atmosphere is especially important and play a major role in the deciding the mental health status of a working married woman. Favorable attitude of colleagues, conducive workplace atmosphere, favorable attitude and the scope of sharing problems with husbands and in-laws were found to be protective of mental health. Women who spent some time in fulfilling social obligations and devoted some time for yoga, meditation, exercise had good mental health outcome. Now, what are the measures that can be taken to address these problems among the working women? There should be sincere effort at workplaces in building a healthy relationship among the employees, developing favorable attitude towards the colleagues and towards each other, and this will go a long way in maintaining good mental health. At family level, working women and their husbands must be counseled regarding sharing their own problems with each other and finding a viable solution for the problems they're facing, and this will also go a long way in preventing the development of poor mental health. And in addition, community-based orientation programs should be arranged at regular intervals. This should deal with various aspects of mental health and emphasize the beneficial effect of activities like yoga, meditation, and exercise on mental health. Thus, this will encourage the working women to incorporate activities which will be relaxing to them in their daily routine, and all these measures, when taken together, will definitely help in maintaining a good mental health status of the working women of our country. Thank you.